Fund. It's my great pleasure to introduce Dr. Jonathan Kennedy, who's a senior lecturer in global public health at Queen Mary University of London. Dr. Kennedy completed his PhD at the Department of Sociology, University of Cambridge. His work has been published in top journals such as The Lancet, Social Science and Medicine, or European Journal of Sociology, as well as in non-academic outlets such as The Guardian, El País, or Al Jazeera. Dr. Kennedy's research interests focus on social, political, and economic determinants of health. In particular, two main strains of his work are effects of armed conflict on population health and vaccine hesitancy, which is also the topic of today's lecture. According to the World Health Organization, vaccine hesitancy is a leading global health threat. Rejection of the COVID-19 vaccine lessens the probability of herd immunity and could extend the pandemic. Therefore, it is crucial to study how the wider social and political context influence concerns about vaccine safety. Today's talk will give us a glimpse into Dr. Kennedy's research on effects of anti-establishment sentiments on vaccine hesitancy. This session is divided into two parts. First, the talk, and in the second half, we will have some time for a Q&A session. Over to you, Jonathan.
Thank you so much, Katarzyna, and thank you to everyone for tuning in to listen to this. So as Katarzyna kindly pointed out, I'm going to talk a bit about the link between anti-establishment politics and vaccine hesitancy over the next 25 or 30 minutes. And this is something that's, I think it's probably occupied all our minds over the last year, thinking about vaccines and thinking about possible barriers to vaccinations. But it's actually something that I was thinking about a little bit before that, because I was thinking about measles. And it's interesting, if we go back before kind of COVID-19, before spring of 2020, when this became a massive problem, when this death and devastation spread, there was already concern with measles, and measles is actually much more infectious than COVID-19 as a disease. If we look at the R number, which you probably didn't know anything about a year ago, but you probably do know something about now, the transmissibility of a disease, measles is several times more transmissible than COVID. And so in many ways, it's seen as a, what we would say in English as a canary in the coal mine. So a early warning sign that there are problems in a health system, but also problems in a bigger social, political organization. And we saw in Europe between 2015 and 2019, a really exponential increase in measles cases. And we saw something similar in the US, which in 2019 had its biggest measles outbreak for 25 years. So it's interesting. There were already signs before the outbreak of COVID that there were problems, that there might be a massive pandemic and that our health systems weren't capable of coping with it. And this was a reflection of broader social and political problems. So I'm going to be talking a bit about that and a bit about how that work relates to COVID over the next 20 minutes or so. So let's start off with this title from the Guardian. And vaccines provide humanity with the clearest and the shortest path out of the death and the devastation of the last year. Scientists have worked incredibly hard to develop effective vaccines, and although there's been lots of talk about dangerous side effects, if we look at the data, the benefits of these vaccines are much greater than any risks that are posed. And so we saw around Christmas time headlines like this one in The Guardian that vaccines had been found to be 95 or 92 or 90% effective. But this is only in a clinical environment, and vaccines are only 95% successful in the real world if 100% of people take those vaccines. And there are various reasons to be concerned that people various things to be concerned about. And these are to do with both the supply and the demand of vaccines. These are the major obstacles historically to vaccination programs. And certainly the supply of vaccines is a big problem. It has been historically. Certainly if we look at polio or measles, supply of vaccine was a big problem in lower middle income countries until about 20 years ago when Gavi and the Gates Foundation got involved. But we're seeing a real regression in the last few months in terms of supply of vaccines when we look at COVID-19 vaccines. And this is a graphic from the Economist Intelligence Unit, but we really see vast disparities between regions when we look at the availability of vaccines. And of course, this has very, very clear political and economic determinants. But I'm not going to be talking about that today, even though it's an incredibly important issue and an incredibly concerning issue. I'm going to be talking more about the demand for vaccines in high income countries. And certainly there's plenty of evidence to suggest that we should be concerned about demands for vaccines in high income countries. And all sorts of surveys have been published over the last few months looking at the issue of vaccine hesitancy towards the COVID vaccine and attitudes towards the COVID vaccine. And you get some really quite surprising results. Over a quarter of the people in the US who were questioned said they wouldn't, or they probably wouldn't, or they definitely wouldn't get vaccinated. The figures were about 1 in 6 people in the UK. But of course, this goes back much, much further. And I suppose I have a pan-European audience here, so you don't need reminding about even the pre-COVID problems with vaccine confidence in France, where a third of the population believed that vaccines were unsafe. And also, if we think of the 2018 election in Italy, all the controversies about vaccinations that were kind of brought up by anti-establishment politicians. So there's a real need to be concerned with uptake of vaccines in high-income countries. When we conceptualize attitudes towards vaccines, it's important to move beyond this binary understanding of attitudes that places a big emphasis on so-called anti-vaxxers. And anti-vaxxers get a lot of publicity, but it's important to remember that attitudes towards vaccines can be conceptualized as a spectrum. And on one extreme, you have fixed anti-vaxxers. At the other end of the spectrum, you have a lot of people who accept that vaccines are safe or that the benefits are much greater than the risks. But then also in the middle, you get this big group of people who waver either way. They could be referred to as fence sitters or as persuadables. And so attitudes towards vaccines aren't dichotomous. There's a big group in the middle that are open to persuasion, that want to do what's best for them and their families, that are looking for information and trying to make sense of that information. And that gives us some hope, I guess, as academics and as people who want to influence policy, because if we look at research on science communication, actually it's often counterproductive to engage with extreme anti-vaxxers. Even if you tell them the information about vaccines, if you share with them the data about their importance and their safety, that more often than not has a negative effect. It just reinforces their beliefs. But these big mass of people in the middle, the persuadables, it's possible to get to them and to explain the benefits of vaccines and to change their mind or to reinforce their confidence in vaccines. So, obviously we don't live in a vacuum as academics. We don't necessarily want to live in an ivory tower, and this gives us some hope that we can have some influence. when we're thinking about what is driving vaccine hesitancy, I guess this is true for any kind of social science question, I should say, but it's important to remember that the causes of vaccine hesitancy aren't straightforward. They're complex and they're context specific. But I still think when we look at this issue, we tend to find an underlying sentiment that drives vaccine hesitancy. And I've looked at vaccine hesitancy in Western Europe, and I've also looked at it in other places as well, like Pakistan, northern Nigeria, Somalia, and there seems to be an underlying sentiment based on distrust towards elites and experts, and this seems to be driving that, driving vaccine hesitancy. So I think it's just interesting to think why vaccine hesitancy is an interesting issue for multi or interdisciplinary social science, and there's a couple of reasons for this that I noted. First of all, when we look at vaccine preventable infectious diseases, obviously we have the biomedical and the public health means to eradicate or to vastly reduce these diseases. They don't have to exist, and so when trying to understand why these diseases haven't been eradicated, why the incidence hasn't fallen as fast as we might imagine, we have to look at social, cultural, political, and economic factors. Just looking at biomedical things, just looking at public health aspects of the problem doesn't really help us. We have to look at these much deeper, much more profound causal determinants. Secondly, it's not an exaggeration to say that vaccines are really one of the great inventions of medical science, and vaccination programs are one of the great initiatives of public health programs. So WHO estimate that vaccines save somewhere between 2 and 6 million lives every year, and that was even before COVID-19. If we think of a disease like smallpox, which has been eradicated since the late 70s, early 80s, that killed 300 million people last century. So it's really remarkable how many lives can be saved by vaccines and vaccine programs. And if you look at liberal optimists, if you look at people like Jeffrey Sachs, like Hans Rosling, like Bill Gates, they will all point to vaccine programs as one of the brightest signs that humans are capable of progressing, of making their lives better, of overcoming the barriers posed to human and social existence by nature. And so I think vaccines are really interesting to focus on, and it's really interesting to focus on vaccine hesitancy because this is a challenge to that hegemonic view, that hegemonic narrative of progress. And so it really kind of raises some fascinating questions. And I think the other really interesting issue from a social science perspective is relates to the issue of herd immunity. And so vaccines obviously work on an individual level. Hopefully, many of you, some of you have all been vaccinated or will be vaccinated very soon. And in very basic terms, if you're exposed to, if your immune system is exposed to the antigen in the vaccine, your body produces antibodies, and this gives you individual immunity to a disease. But it's also important to remember that vaccines work on a community or a social level as well. And this is because of something called herd immunity. So not everybody in society can get vaccinated. People with compromised immune systems, people who are undergoing chemotherapy, for example, people with various illnesses and diseases and conditions can't be vaccinated. And if enough of the people in a society who are well are vaccinated, this also protects these unvaccinated people because outbreaks are very, very, very unlikely to occur. And this is an issue of social justice as well, because many of the people who can't be vaccinated are are the most vulnerable in our society, the sick and also very, very young children. And this raises the issue of what should we do? What should we do about vaccine hesitancy? What's the solution to this? And this really kind of gets at some really profound questions related to political philosophy and the right of the state to interfere in lives of individuals and families when we start talking about mandatory vaccinations. And so again, this poses a really, really fascinating question that has not just ethical, but also real world political implications. Because if we look at Italy in 2018, really the issue of mandatory vaccinations was a really hot potato, and one that was exploited by the Liga and by the Five Star Movement. The previous government had kind of made vaccines mandatory for young children, or at least there were fines for not getting your children vaccinated, and this created a big controversy, and it was exploited by these anti-establishment parties. So this is another reason why it's really, really interesting from a kind of social science perspective, why it shouldn't just be left to people in medicine or people in public health, why sociologists, anthropologists, people in political philosophy, political science, economics can also add something to this topic. So let's think a bit about what my research has focused on the last couple of years, which is looking at the link between attitudes towards vaccines and populism. And I first became interested in this issue because around 2018, obviously everyone in academia, but also beyond academia, were thinking about these new anti-establishment politicians and political parties that had come to the fore in Europe and also in the US. If we think of the rise of Trump, Brexit in the UK, the rise of Alternative for Deutschland, what was going on in Italy and France, there seemed to be, there was kind of, it was really worrying from a personal perspective, but fascinating from a professional perspective. And I was thinking about how this influenced health. And there were a few anecdotes out there, a bit of anecdotal data suggesting that there was a link between populist politicians and kind of anti-vaxxer or vaccine hesitancy. And a good illustration of this is the tweet in the bottom right-hand corner of the screen at the moment. It was from Donald Trump. It's actually 2014, so before he was elected, but he was clearly spreading misinformation about the MMR vaccine and its dangerous side effects. This rumor, this idea that MMR vaccine, measles, mumps, and rubella vaccine causes autism is based on a now retracted paper by the disgraced researcher Andrew Wakefield, and he's actually been struck off the medical register in the UK because of this research. It was seen to be unethical, and I was curious about this, and there were other cases as well, certainly in Italy, as I alluded to earlier, and I wondered whether there was a link and whether we could prove that with numbers. And so I just plugged some data into a really simple plot, as we see here on the left-hand side of the graph. You have left-hand side of the screen. So I used data from the 2016 European Parliament elections, looking at what proportion of people in a country voted for populist political parties. And then the other variable I looked at was the number of people that said that they believe that vaccines were important. And I also looked at vaccines being effective and vaccines being safe. And you got very similar results with every one. There was a very, very clear association, at least, between votes for populist parties and attitudes towards vaccines. So countries in which there were very, very high votes for populist parties also had very low vaccine confidence, and vice versa. So obviously there are all sorts of problems with scatter plots of national level data, but this at least is suggestive of something. And subsequently, I've looked at some individual data, and other people have looked at individual data that that seems to support the fact that there's a link. And just an example of that is this graphic from The Guardian, and they had some YouGov data, so some survey data of about 10,000 people across Europe that I helped to analyze, and it showed a pretty strong link between voters at the individual level for right-wing populist parties, and they were asking people whether they believed in kind of conspiracy theories about vaccines. And so we found that in the UK, for example, only 10% of Conservative and Labour Party voters believed that the government was hiding information about the dangerous side effects of vaccines, whereas among what were then UKIP voters, so Brexit voters, the figure was about a third of those voters, and the figures were even more startling in France. So there certainly seemed to be something going on, and something that was worthy of explanation. And I think, I've tried to think about what this link is, and very simply, if we look at a kind of classic definition of populism, it is in the political sphere, it relates to a lack of trust and anger towards the established political parties and established politicians. And this seems to also manifest itself in other spheres, including in the sphere of public health. And in public health, it seems to manifest as distrust, as anger towards elites and experts. So that can be doctors, that can be pharmaceutical companies, and that can be the state that is advocating vaccination programs. So whether we look at populism in the political sphere or populism in public health, there seems to be this underlying sentiment of distrust towards the establishment, and that's how I would conceptualize this link. I wouldn't see it as a clear causal pathway, more as this kind of underlying distrust being being the driving force behind this link. So let's have a think about what might be causing this. I suspect most of you, if not all of you, are a bit younger than me. So maybe you can't remember a time when social media and the internet didn't play a really, really important role in our lives. But it's a truism to say that the internet has absolutely transformed the way that we access information, and also the way that we communicate with one another. And this has certainly had a big impact on attitudes towards vaccines. There's various survey data that shows this, and there's been a lot of research done the last few months, actually, showing that people are exposed to misinformation about vaccines and COVID vaccines on social media, and two, that this has an impact on their attitudes towards vaccines and their willingness to vaccinate themselves and other people. So certainly social media does play a role, but it's also interesting to ponder the question of who's creating this misinformation, who's spreading rumors about vaccine safety. And there was a really, really interesting piece of research a couple of years ago that looked at Twitter accounts that were spreading misinformation about vaccines. And it found that the same Twitter bots that were spreading misinformation about Hillary Clinton in the 2016 election were also spreading misinformation about vaccines. And so that piece of research argued that these were Russian Twitter bots and trolls, and that these were really kind of using vaccines as kind of a wedge issue to drive social discord in North America, but also in Europe. So this kind of is fascinating, and it also adds another level to the topic of vaccine hesitancy and attitudes towards vaccines, because it becomes a question of international security and international relations as well, which I find really interesting. Let's just ponder this for a minute. So obviously, as I said, vaccine hesitancy was already there. We had this big controversy about measles, mumps, and rubella, and the link with autism that was disproved, but that still continued to arouse suspicion among many people in Europe and in America. But COVID-19 seems to have supercharged the debate about vaccines. And this is for two reasons, really. Firstly, I guess one of the big concerns about vaccines was that people believed it was just a way for big pharmaceutical companies and to make a lot of money. And the fact that COVID-19 is such a big issue, this and so many vaccines will be needed. This aroused suspicion even more, because people said, look how much money will be made by pharmaceutical companies who kind of come up with successful vaccines. So there was this idea that pharmaceutical companies would cut corners in trials in order to get their vaccines out as quickly as possible. So certainly this really heightened suspicions about the safety of COVID-19 vaccines. And I guess also the last year, with things like lockdowns and kind of the question of whether the state should mandate people to wear things like masks in public spaces. This has also really kind of really ramped up the debate about the right of the state to intervene in issues related to public health. And so this has also aroused suspicion about big state programs that roll out vaccines. It's also important to say that despite the fact that there's something very new about vaccine hesitancy in the last few years and about COVID-19 vaccine hesitancy, there's always been a sense that there's always been kind of rumors in public health about, there's always been rumors, and there's always been this distrust of doctors. There's always been a distrust of elites and experts during public health crises. And so this picture here is from the Black Death, when there were various rumors about what was causing the Black Death, but the most kind of horrific was the suggestion that Jewish communities in Central Europe were poisoning wells, and this actually resulted in really horrific violence against the Jewish community. But wherever we look, whenever we look at a public health crisis, we see misinformation, and so in a sense there is nothing new. But I guess the big difference today is the fact that if we look at the Black Death, even if we look at another interesting example is when cholera first came to Europe in the middle of the 1800s. It was a new disease. It was really a shocking disease because it killed people within a few hours. They would basically be sick and have really horrific diarrhea, and they would die within a few hours of dehydration, and their bodies would turn blue. So this was really, really horrific, and it affected poor people much more than it affected rich people, particularly poor people in the new growing cities, industrial cities. And And so there was various rumors about this being a conspiracy by rich people to kill the urban poor, and this led to riots and social unrest throughout the industrial cities of Europe. But I guess the big difference between these examples and today is the state of popular knowledge. Back in the late 14th century, or even in the 19th century, people lived in what Max Weber referred to as a mystical garden. They still explained physical phenomenon with reference to magic and witchcraft and superstition or the will of God. Whereas today we have so much scientific information about how vaccines work and about how diseases are transmitted. And so this is the big difference. You know, everyone today has the information available to them to show them that vaccines are important and effective, and that the benefits far outweigh the risks. So I guess the important issue to explain, this is what I'll do in the final few minutes, is to think about why, despite the fact that this information is available, why people still reject vaccines in large numbers. So Weber also noted that the process of modernization was accompanied by disenchantment. So not in terms of people being dissatisfied, but he's talking about a demystification of explanations for all sorts of physical phenomena. And so the reason why I have this moon photo up, is because around the 1950s, 60s, it seems like faith in science was at its peak. And Mark Fisher refers to the period around this time as popular modernism. And he's talking about culture, but I think we can also talk about this, or this also can be used to refer to attitudes towards science. And I think, at least in advanced capitalist societies, at this time in the 60s, there was really a strong belief that this was a time of broad-based economic growth, that the welfare state was expanding rapidly, and that great technological advances were improving people's lives and would continue to do so. As a result, people believed that the world was getting better and that science and medical science would play a role in this. So there was a real faith in science and in medicine. But from this point on, from the 1960s on, this faith in science seems to have gradually eroded. And this began with a very, very justified and very informed critique of the scientific method in academia by people like Bruno Latour and also Harry Collins more recently. But this has opened up Pandora's box of uninformed and extreme criticism of the scientific method and of science that throws out the baby with the bathwater. And Harry Collins has referred to this as scientific populism, and we see it in all sorts of arenas. We see it when we look at attitudes towards climate change. We see it when we look at communities that claim that the earth is flat rather than round. And we also see it when we look at some attitudes towards vaccines. So I think in a way this can be seen as what we might call, if we're going to might refer to it as the re-enchantment of society. So a significant proportion of the population in late modern or postmodern societies seem to want to find meaning in their lives by engaging with anything from spiritualism to conspiracy theories, and kind of concerns about vaccines seems to be part of this. So I'm just going to summarize by thinking a bit about the practical implications of all this. And I think, first of all, it's important to be humble and, certainly it's counterproductive for most people to refuse to have vaccines, just as it's counterproductive often for Trump voters to vote for Trump, or for Brexit voters to vote for Brexit. But I think we need to have some humility and need to try to understand why people do choose to vote for populists or do believe in vaccine hesitancy. And actually, we find some very, very good reasons. So with regards to vaccine hesitancy, I mean, it's perfectly rational not to trust pharmaceutical companies. If we look at the history of pharmaceutical companies, there's a litany of examples of them profiteering and not caring about people's health. The most recent example of this is probably the opioid crisis in North America, which is a matter of public record that has been fought out in court cases, and we see that pharmaceutical companies cynically sold opioids to people knowing their harmful consequences, and made billions and billions of dollars doing so. Also, it's perfectly rational for people not to trust the state and not to believe that the state has their best interests at heart. Even before COVID-19, we saw in the UK and in the US, life expectancy was stalling or even going into reverse. And there's been various research showing that this is a result of government policy. In the UK, a result of the so-called austerity politics and policies. So again, it's perfectly rational for people not to believe that the state has their best interests at heart. So I think when we look at this topic, we have to really bear this in mind, and we have to understand that people that vote for populists, people that are concerned about vaccines, they're often people that are economically marginalized, that feel disenfranchised by mainstream politics, and this creates a big issue because basically improving attitudes towards vaccines, it isn't just an issue of public health education. It isn't just a question of putting up posters or TV adverts that tell us about the benefits of vaccines. It becomes a much bigger problem about trust in society, about feeling as though people are part of society and have a social contract. So it becomes a much bigger issue that concerns all of us. So I'm going to leave it there. It's 20 minutes to now, and hopefully that was all clear. If people have any questions, if there was anything that I went over too quickly or didn't express clearly, then please feel free to ask me. I'm living with me and my partner had a baby a few months ago, so I'm kind of permanently sleep deprived at the moment. So I hope I made sense. But if you want anything clarified, please ask, and I'd be happy to try my best to answer.